Contacto Gutiérrez Robledo, director general del Instituto Nacional de Geriatría.
We have Dr. Clemente Ibarra, Dr. Luis Miguel F. Gutiérrez Robledo. I also have the opportunity of introducing Flor Murillo from Costa Rica. Thank you very much for being here with us today. We also have Mrs. Viviana García Murillo. She is a director of Geriatrics in Valparaíso, Chile. Thank you very much, Professor Viviana. And also in Mexico, besides Dr. Luis Miguel Gutiérrez, I also have the opportunity of mentioning Dr. José Ibarra, Ponce de León, Luis Guillermo Ibarra, and he is now the director of Sports Medical Mexico. Thank you, Clemente, for being here with us today. We also have Dr. Víctor Zamora Mesía, the ex-health minister and current professor for the Health MBA from Centro Católica in the University Cayetano Heredia in Peru. Thank you very much for being here. And lastly, we have Dr. Ricardo Peña Silva, professor and researcher from Los Andes, Colombia. Dr. Luis Miguel Rodríguez will now like to make a precision in regards to certain terminology for healthy aging in geriatrics. Thank you very much, Santiago. Just briefly, I would like to say that healthy aging is what was proposed by the WHO in regards to their reports that were done 6 years ago, and it talks about the well-being at a more advanced age. Longevity talks not only about the last part of life. Nowadays, we are also experimenting an extension of life, and I think that it's important to make this distinction. What's more, we have this new science whose origins can be traced to the Aging Institute in California, known as Geriatric Science. The idea of this is to understand the characteristics of aging and the mechanisms behind chronic illness, considering that in the beginning they may be confused, though they're the same thing. And in this case, the incidence in the aging process would allow us to modify chronic illness. So I think that this gives us a reference framework so that we understand what we want to do. The idea is, of course, yes, healthy aging, but the idea is for us to take our experience and the definition of the WHO, or even go a little bit more about what's been talked about during this summit. So I believe that they're both quite interesting definitions. Thank you very much, Dr. Luis Miguel. We would now start with the first round of questions. I will start with Flor Murillo. I would like to know which are the first programs and their achievements in terms of healthy aging in your country. I think that you're muted. Hello, good afternoon to everyone. Thank you very much. I would like to say hello to everyone from Costa Rica. In regards to the question that was done right now, Costa Rica has an advantage. We just have 5 million inhabitants, and that means that implementing programs is much more easy. Even though we have around 10% that is an advanced age population. We have several opportunities. The first one is taking care, network. It is for us to be able to take care of those people who are homeless and that need some sort of care. Now, with the different programs that we have right now, what have we wanted to do is to create a voluntary strategy so that we can align all the initiatives that we have. We have several initiatives in different places, just as it was mentioned. However, they are not integrated. And since they're not integrated, we have an access problem, or basically repeating the same people in different programs. The idea has been to involve as many institutions as possible, government institutions, so that they can be integrated and so that we can have greater coverage, which is pretty much one of the biggest issues that we have. We have several programs for education, for health care, and for public health in general. We have several successful programs. The situation here is how can we make sure that people are actually engaged in these programs and are actually participating in these programs actively. So what we're doing right now for healthy aging is, of course, to have healthy goals for the next term. Okay, so what about Chile? What can you tell us? Okay, so good afternoon. First of all, thank you for inviting me and for giving me the opportunity of sharing my experiences. Well, considering that I have been working on this topic and not as someone that is actually going through this right now, and I believe that this is extremely important to be clarified, I believe that there has been some advancement in our countries in regards to the creation of a commission for the elder adult. We started in 2002 with a program that promotes and contributes to have a positive perspective for aging. We don't yet talk about healthy aging, which is, of course, what the WHO has wanted for this decade, but we have implemented different products and programs, especially, as Flor was saying, to try and have this comprehensive integration that is so difficult and that sometimes runs through our resources without actually reaching all the people that is needed. We have a national politic for positive aging. It started in 2005, and right now we have a new law act that wants to promote positive aging through 4 different actions that have been denominated as institutional participative. But we have the need to have these older people be incorporated in different politics all throughout our country. Thank you very much. Now, Dr. José Clemente Ibarra, I would like to know your perspective from the regenerative medicine perspective in terms of healthy aging programs. What do you think about that? You need to turn on your mic. Thank you very much for the invite. It's an honor to be able to be here with people such as the one I'm sharing this forum with. And I would also like to say that we are doing research for different strategies to improve quality life during the aging process. And though these are isolated efforts, this is already taking place in Mexico, and this is being done in the Rehabilitation National Institute, where rehabilitation cannot be seen as the last stage for the treatment of patients. We have to consider prevention, treatment, and rehabilitation. Rehabilitation should always be considered. And Dr. Luis Guillermo Ibarra actually mentioned, which is basically preventing disability. And if we understand that part of the changes that take place during aging, rehabilitation is extremely important, especially if we consider it. And one of the first things that was mentioned in the forum in the morning was using cells that would help us not only treat established diseases, but also how to prevent some of these diseases that are a consequence to aging. And this would have an extremely important effect when improving quality life in a person. A clear example would be maybe osteoarthritis, which is a health problem around the world. If we could prevent some of the cases of osteoarthritis through regenerative medicine, we would be advancing in different areas. But in the morning, it was extremely interesting to see how those regenerative medicine options could actually help us understand that the effect of the cells and the organs and tissues in our body could actually help improve the way of life of people nowadays. Okay, and Dr. Zamora, what about Peru? Well, good afternoon. I'm extremely glad to be here with you at this panel, with you and with the audience. Now, this is a very difficult question for Latin America in general, but specifically because we would have to give the characteristics of our health system that are characterized by its fragmentation and its segmentation, as well as the concentration of resources in the big cities where the different areas have the right resources and other places don't. We understand also the high costs for the health system, and we know that Peru is not an exception. Now, one of the situations that we can see within our system can be divided in 32 different systems, and we have 52 different funds. And that makes it extremely difficult to coordinate the few programs that we do have, especially for those that are for aging. So as I was saying, out of the few programs that we do have, they do not have a wide reach and they don't have enough coverage. And they're usually given through several initiatives, just as Dr. Murillo has mentioned, that are sometimes very difficult to match given our different institutions. We have some medical services programs, some health programs directed for autonomous elderly people, and we have others for populations at risk. But these programs, as I was saying, do not have a wide reach, and one of our wider programs that are for people above 65 years only have around 500,000 people. Some may be directed in different systems, for example, for vision acuity or physical rehabilitation. But for health needs, we know that we still have a wide gap. And I would just like to say that in Peru, as well as in other countries in Latin America, we know that this is actually eating up on our different government systems.
Thank you so much, Dr. Zamora. So, in Colombia, Dr. Peña. Well, thank you very much. Well, from the first decade of this century, there were some reforms done in the Colombian policy trying to create some laws that would favor those healthy aging strategies. However, as it happened several times in countries in our region, the execution for those policies takes a long time. So even though some of these decrees were issued in 2018, it was not until 2019 where we had the go in order to activate something, which is the National Council for the Elderly, which has allowed to have the participation of elderly people in the Ministry of Health contributing to the decision making. So even though from the first decade it's still in paper, it hasn't really been executed. So there's also an aging policy considering several elements, such as respecting the rights of the elderly, the active aging, the social protection for the elderly, which we were hoping to have a little bit more visibility. But in situations such as the pandemic, you know that the elderly, because of the high risk, were the ones who had the access first to vaccines. At the biomedical level, there are also some regenerative medicine work being done. There's an institute in Bogota, which is the District Institute of Bioscience and Institute in Health, that is working in advanced cellular cultures in order to treat several things like Dr. Clemente was mentioning, in order to have some tissues for joint replacement that would benefit the elderly. Thank you so much, Ricardo. And to conclude this first round and to start the second one, please, Luis Miguel, what is the status in Mexico? And of course, that several challenges have already been mentioned. We have mentioned research, coordination. So how are we doing, and what would be the best strategies we can implement, Luis Miguel? Well, trying to cover everything as a whole, I would like to start by saying thank you, Santiago, and thank you, everyone, for giving me the opportunity to share this. And let's think that in the last 90 years in this country, the life expectancy when being born went from 34 to 75 years of age. That's the life expectancy of Mexicans, which was duplicated in the last 90 years without any pills, without any specific biomedical intervention, just by improving the life conditions and through the social and economic determinants that are the ones that have contributed to this growing longevity in the population. In 1979, the National Institute for the Elderly was created. It was called the National Institute of Senectud back then. That shows how the view has been changing. And in the year 2001, there was the first program specifically focusing on aging. In 2007, we created a work group with the intent of getting to where we're at, the creation of an institution dedicated to the research and teaching in order to improve the quality of life of Mexicans while aging, and the National Institute of Geriatrics that will turn 10 years next year. And within this institute, in 2018, we summoned to a first meeting along with the National Council of Medicine and with the Geriatric Institute of Chile from the University of Chile in Santiago regarding geriatric science. And as of that meeting, where we also had Dr. Felipe Sierra joining us from the National Institute of Aging in the United States, we created our Institute of Geriatrics and the network around this topic. Currently, we have 25 researchers dedicated fully to research in this area, from the technology of aging in the lab, as well as an animal area of research, a clinical research lab, and a big treasure, which is the National Survey of Aging in Mexico, a longitudinal study that has been prolonged in Mexico with a follow-up of 20,000 people. We have analysis of GWAS in 10,000 of these individuals. And all of this helps us to make progress in understanding the phenomenon of aging locally, but even more to make progress in improving quality of life while aging in our country. Thank you very much, Luis Miguel. Dr. Flor, or I apologize, Mrs. Flor, you have already talked about coordination, but what other challenges, specifically in Costa Rica, are you dealing with, and what challenges have you overcome, which I believe there must be many? You have to activate your microphone, please. Well, one of the challenges definitely is the political support from the highest level. We currently have 27 candidates running for the presidency of the country, and out of those 27 candidates, they still see the elderly as a fragile person that needs help, and not someone that's a human being that we need to work with in all of their areas in order to boost their functional capacity as well as their intrinsic capacity. And they do not really visualize an overlook that we can really work with an aging in a comprehensive way, both in the social and the physical area, with everything that has to do with the public health and everything. So another aspect that is related to this is how to eradicate those topics so that we can really reach the population in an effective way. With regards to the pandemic, what has been happening, it is really difficult to really spread the message in an effective way so that the actions and administrative measures taken are not misinterpreted. Same thing happens with healthy aging. It's a matter of seeing how to work with a population with awareness and working in eradicating the misinterpretation. Something else is the dependency. This is not something that just pertains to the poor population. It pertains to all the socioeconomic classes and to all the population, where we need to work with the support of all the families, which is required at all levels and different stages. And the dependency in Costa Rica of people with chronic diseases, we have 1.5 million of people with this type of diseases. And just picture, we have 5 million of inhabitants, and we have 1.5 million with chronic diseases and 800,000 people who are dependent because they have disability issues as well as age issues. Therefore, this is a huge challenge, which is also expensive, and that we need to work hand in hand. There's just a policy, long-term care policy that has been created in the social aspect, and it is not related with the public health or with the healthcare services. However, we have those challenges in front of us. And as I mentioned, working with age, we have opportunities with a healthy aging in order to convince the politicians in terms of the commitments that can be attributed to the country and that we can take on in an effective way. So we would wait for this change of office that is coming up next February to see if we can really position in the political agenda this issue. Thank you very much. Thank you, Flor. Continuity definitely is an important aspect. So, Mrs. Viviana, how are we doing in Chile? What other challenges do you have there? And how are you going to address them? I'm going to make reference to what the elderly mentioned, and also from what I can see as of my work and my experience. Chile is one of the 3 oldest countries in Latin America. It has an average life expectancy of 80 years of age. It has a population of elderly citizens, which is 20%, which is the situation of my region, which is Valparaíso, also with a high rate of aging in some cities of our country. Therefore, as you can see, we are dealing with a very important challenge when it comes to the generation of actions and policies aimed at the elderly. This was also mentioned by Flor, the integration of this social health standpoint in terms of the elderly. We're making progress in this aging policy. This is a work that has been well included in a positive way, and also the social ministry and the health ministry that made an agreement in this work, and we're also providing support to them. We actually were in a pilot test of a more comprehensive work along with the Geriatric Institute of Mexico and other countries such as Costa Rica. We are on the same page, and I think the most important challenge is being able to include this work from the different standpoints. Another challenge has to do with how to include the focus of rights at work for the elderly, which is super important in Chile. In 2015, the Inter-American Convention of Human Rights of the Elderly, which was ratified in 2017, the state of Chile has been sued by the relatives of an elderly citizen because their human rights were not respected in terms of getting information regarding healthcare as well as delivering those health services. And from the point of view of the challenges, seeing from the point of view of the elderly, there's a huge need from elderly citizens to create a ministry for the elderly. Right now, this is a service that depends on the Ministry of Social Development, but considering the percentage of the elderly in our country, people expect to create a ministry, making progress in terms of social security. We are one of the countries that has a big coverage of pensions compared to others. However, these pensions are still still have low incomes, and unfortunately, this is not really useful for people to live. Another challenge has to do with the generation of effective participation spaces where people really have an incidence and they can make decisions. This was also mentioned by Flor. The pandemic is the best reflection of how the elderly saw their rights violated and how there were some decisions made that affected them directly, and they were not included in that decision-making process. And lastly, when it comes to health, that is a huge issue. It's true that we have made progress on this by creating some health care programs, but it's still insufficient. Thank you very much, Viviana. So there's no question that new technologies play a very important role in this area of a healthy aging. And as it has happened in the last 20 years, I remember from the first draft of the human genome, there were huge expectations regarding the usefulness of the application of this knowledge. Therefore, I would like Dr. Clemente Ibarra for you to tell us when it comes to regenerative medicine, what to do and what is the status and what is the scope, but really what is the reality? Because sometimes people hear different information and we really lose this dimension. So please go ahead. Well, it's really interesting to see what is being posted in this panel, as well as the things in terms of accessibility and basic services for the elderly, all types of services from the standpoint of view, social and medical. And of course, the coordination, the lack of coordination in a lot of our countries creates an issue. So it's true that there are some interesting opportunities going on with the research point of view. One of the main issues is the access to this, for them to really become actions that benefit a group of the elderly. And that's where we have some of the issues that I was mentioning earlier regarding prevention and about what could we do in order to do that, to have a healthy aging. And if we were to achieve for the population to have access to programs of healthy aging where regenerative medicine could play an essential role. So we could change a little bit what all Latin American countries are facing, that lack of access to healthcare services, that lack of access to resources and to being able to do this research and provide our health services. And we could reduce this somehow if we were to achieve for aging to be obtained in a healthier way. So as I mentioned earlier in one of the presentations earlier, is how could we have an incidence so that osteoporosis, osteoarthritis, and sarcopenia could, if not being reverted, have a stop or improved. And that could definitely improve, especially with the elderly, for them to be less fragile and less dependent. And of course, the support that they would need, social services and the family themselves could face. I mean, they could be limited somehow. So it's true that it's a challenge regarding some of the topics that are already being researched from the biomedical standpoint. And how could we put a stop or extend the well-being on patients with less osteoarthritis, osteopenia, sarcopenia, and fewer mental problems, and even some brain problems. So that way patients could get to advanced ages without needing so many support from the government or from the family, and of course from the general society. Thank you very much. So we have already mentioned several challenges, and now I would like to ask you if you have identified other challenges and the way in which you are dealing with them, and what are the strategies that are working and what's still left to do? Well, yes, of course. I want to add on what has been mentioned earlier. First of all, it has to do with the political and institutional environment. And I think that all of Latin America is actually dealing with a huge institutional crisis, as well as the weakening of the governments and public policies. In the case of Peru, in November of last year, we had two presidents, two Congresses or two chambers or House of Representatives. And I think that you were all witness to this. And that situation has not been eliminated in Peru or in Latin America, which is something that Chile, Ecuador, and Colombia, as well as other countries, are dealing with. Brazil is also facing some instability in terms of the political environment. And actually, it has a direct consequence in the national plan for the elderly, as it's called in Peru, because this has not been ratified. I mean, the previous version had to give light to the next version, and because of the political turbulence, it has not been approved. So we do not have a national policy for the elderly. That's the first challenge. The second one is the institutional capacity for those conducting public policies, in this case, the Ministry of the Women and Vulnerable Population, plus the Social Inclusion Ministry as others, in order to outline the policies going forward that would include what Dr. García and Dr. Murillo have mentioned, as well as other approaches such as gender. 54% of the breadwinners in Peru are actually women, elderly women, compared to men. This is something where the policy cannot really just give their back to. And also rurality. The field or the countryside has been neglected by the youngsters. And in the rural populations, we only have elderly people who have really restricted social media, as well as native populations, which needs to be addressed from an intercultural approach. And in the fourth place, institutions such as the Ministry of Health, where we have to include in all of our services a huge amount of technology, and we need to assess which are the ones that they can absorb, taking into account the little resources we have in order to make them effective for the needs of this population. Well, thank you very much.
Alfonso Peña, ¿cuál es su visión, su percepción?
What is your perspective in regards to regenerative medicine in Latin America and the access that Dr. Ibarra was mentioning, the cost, and what are we still missing to reinforce this matter? We need to understand that we are behind in regards to other countries, other developed countries, and the technology that they have. Thanks to the advancement of technologies, we are able to see some institutions with higher resources to actually help and invest in this situation. Actually, when we heard about Luis Figuera talking about a study done in Mexico about aging and how in most other countries it doesn't really exist. If we are to compare these with other studies that are done in other countries, well, Mexico is still lacking. We're quite far away from other countries. And I believe that it's really important for us to collaborate. At least in our country, it's still quite active, this competition chip, and moreover, we don't have as many resources. So we know that if we were to come together and work as a team with the few resources that we do have, we would be able to be more efficient. We also have an institution, well, it's not an institution, it's more of a laboratory that has people that could actually help and have higher collaboration, some institutions that I've already mentioned, and some other universities that already have some sort of work. We work with the University of Chile or the National Autonomous University here in Mexico. So I believe that this is important, to have access, to have collaboration opportunities, and to have resources that can actually be used as a team. I was part of the Interstellar organization, which is based in Japan. And what they're doing is actually coming up with pilot research that helps aging situation. And the idea for this program is to actually help small grants, through small grants. But the idea of this is that though they were small grants, they could actually help start some pilot projects that could, in the end, develop into wider projects. I believe that there are other opportunities in Chile, and I remember that I used to think it would be amazing to have that in Central America or South America, and for us to actually strengthen these teams. So I think that this is the way. That would be my answer. We already know, but if we were to work together, then it would be easier for us to go forward. Thank you very much, Ricardo Alfonso. Now, Dr. Luis Miguel, you actually talked about the advancements that geriatrics has had in Mexico. And I remember that when you started in the 80s and the 90s, but if we were to actually take a current picture, how would you grade it? Because I understand that at one point in the past decade, we had a sort of progressive descending trend. So what do you think about the advancement of geriatrics in Mexico and Latin America? Because they have talked about the investment and the need for it, but what are the measures that we could take so that we can actually foster the advancement of geriatrics and healthy aging? Well, thank you. Thank you very much, Victor. We are right now talking about a wide array of topics. And I mean, this is not a surprise. If we talk about aging, we talk about life itself. And here we're trying to understand from this biological perspective and from health perspectives in relation to aging specifically, but we had not mentioned geriatrics. And this is that one of those important things that is important to consider, because we hadn't even mentioned this in Mexico. And before this transformation, we used to have maybe 10 or 12 people graduating from the course in 28. And right now we have more than 100 specialists for geriatrics. So that means that we have a higher number of geriatric specialists. And this is one of the most impactful situations in our institution, as well as the Mexican Health Institute. But aging in Mexico is much more interesting than just, saying, hey, someone is aging. And actually, Clemente has already mentioned a little bit about this. Particularly longevity, which is basically inequality, social inequality. And I was saying that in Mexico, the average age is 75. But if we're to talk about the different economic strata, then we can see a very specific gap. We would be able to maybe intervene with some pills or some miracle remedies when trying to improve aging, and we could maybe even have some high-tech technology for regenerative medicine. But if we are to talk about other social and economic determinants and the global impact in our society, we would definitely have a higher impact. Thank you. Now, Flor, what actions, if we were to think about our current situation, what actions could we do in Costa Rica, specific actions to improve this healthy aging situation in your country? You need to turn on your mic. Well, there's an important work that we need to do in regards to best practices. What are we doing in Latin America as a country? And how are we sharing our different experiences? For example, today, this is a great opportunity, but we have several actions in different countries that are doing things correctly. And for those countries that have less resources, this is extremely important. To actually repeat best practices is a good idea. And it's not only for the countries that are here, but Central American countries that are at a disadvantage, at an economical disadvantage or political disadvantage, and they're staying behind in regards to aging. And this is a situation in Latin America that is important for everyone. So being able to actually see beyond our countries is one of the biggest challenges that we have to face. There are some important organizations such as different non-governmental institutions that could help us with this. But we also need to understand that leadership to empower our elderly citizens is also extremely important. We tried to have a forum that was actually really good, which was a demand for rights, for them to know what they need, or maybe we may think that they need something, but we really need to understand what they need. And this is one of the things that we can see. We had a survey about health services. They're not asking for specialists, they're asking for humane doctors. So instead of actually trying to solve it with specialists, for example, okay, so we'll send him to this or that specialist doctor. What they wanted is that whenever they went to the hospital or the clinic, they were treated humanely. Another challenge that we have is, of course, the economic situation and how to have resources so that we can have a wider scope. And the different technologies, we have two technologies that have been talked about today. The first one has to do with the services for health provision that will help people have a better quality of life, but we also have access and use of technologies, and such as having a cell phone. For example, here we would ask for the QR code for vaccinated people so that they can have access to different institutions. What are we going to do with the elderly people that don't have a phone, that don't know what a QR code is, and how will they have access to the different services that are basic, such as a supermarket? So we are still behind on this topic, and we're discriminating because we're discriminating those people that have no cell phone, because though they may have the vaccine, they don't have a cell phone and they can't give the QR code. So it's important for us to consider what we're doing in Latin America. And what's important is that we're actually going forward, and little by little, we're setting better goals so that we can work together or collectively. For example, I have worked with the Geriatrics institution to develop our own institution. We have started our course so that we can work on this and to make it a part of what we have. So yes, we understand that there are different projects that we can duplicate based on best practices. Thank you very much. So, Professor Viviana, we understand that there are several challenges, but is there anything that you are doing in Chile that you are doing and that maybe you could talk a little bit to us? Well, just as Flor was mentioning, and just as this has been mentioned during this panel, we have to be coordinated at different levels to be talking about healthy aging, not only as different countries, but also as a collaboration in strengthening regional perspectives. We have extremely interesting situations. For us, the Pan American Health Organization has been extremely important for our country and for the work that has to do with aging and elderly people. Flor also talked about this, but the recognition of elderly people as experts, because we're talking about the elderly without the elderly. And so here we understand that there are different challenges, and we have no elderly people that actually represent the elderly population. So it is important for us to open this real participation so that we can have access to everything and the actual creation of the policies, which is not only to evaluate. And I also think that we have commitment. And here I'm talking about the institution commitment, such as the university and the center I'm in charge of, to create some teaching opportunities for the different communities to give access to this elderly population. We understand that there's a certain role that the elderly need to adopt, but there are also some other opportunities that need to be considered. And as it has also and already been mentioned, I think that these are very specific actions that we should comply with. Okay, you talked about changing rehabilitation ideas. And I believe that we all agree with this, but how can we actually get to it? First of all, I believe that we need to help people understand that we have this situation in our region. Mexico is not an exception. And though we have tried to make everyone understand that we're trying to be a part of the different investigations around the world, the truth is that we have some things that are still in need to be talked about. And I think that having to solve some economic and social problems for our population, specifically for health services and actual provision of services. But a reality is also that one of the main problems is coordination. Mexico has really tried through the different health institutes, through genomics and geriatrics institutes, neurology, to really try and catch on the specific problems or challenges that they all face, but we have not decided to work together to face the different problems that may face for the elderly. And I would like to just give you a very clear example. For example, neurological problems, some cardiovascular diseases, or any other sort of issues. But in this case, we would have to talk about really early prevention, which is basically ERs. So we have one of the biggest heart diseases in Mexico, which is hypertension, and this is one of the biggest problems that we face. The next one is some cerebral diseases or accidents that may occur given this situation. So it's important for us to understand that if there is a vascular accident, if a person goes to a hospital, there is no actual immediate attention, and this becomes an actual problem. And so, yes, this is a pre-prevention care I'm talking about. And we also need to consider methodology, because for these elderly people, or for those people who are reaching an age where aging is not healthy, rehabilitation is extremely important. So that is a way in which we can actually improve health conditions for people to actually avoid falls. For example, this is fundamental. An elderly person that little by little loses coordination, balance, or strength needs to have falls prevented. And if we do achieve this, we're not only going to prevent a disability, but we're also going to save up on costs for the family, the system, and the country itself. So here, it is important for us to consider how fundamental this could be, because we would be acting in a way in which we would improve health conditions for these people. I mean, we would be making sure that they avoid any sort of fracture or anything. But we understand that there are other problematics. Science is still extremely important, but we still need to improve it. Because not because we are still looking to improve what we already have, we still need to consider that what we already have is good. So at one point we had a debate about whether or not we should pay for, fitting someone, or to actually have advanced research. But I mean, if we still have to decide on one or the other, we're never going to get there. So there are some basic needs for our population, but to also understand what's being done around the world so that we can achieve it too. Thank you very much. We're running out of time. So I would now like to hear your last words, Dr. Zamora, specifically on the regulation framework in regards to legislation and policy making, because several of our countries are still behind, and this affects continuity of programs. Well, I think that we still need to build on what we learned from the pandemic. 1 out of 3 deaf people are in Latin America, and this is not something that surprises us. And most of our mortality rate has to do with elderly people. So we still need to enforce regulation, but the planification and guidance of the services. So I remember a call to action in 1968 where it says, okay, let's be realists and do the impossible, because the more that this population grows, and in 20 years, 1 out of 4 citizens in Latin America becomes an elderly person, then we understand that the more important it is for us to actually regulate, plan, and legislate to achieve a political consensus within our country is the most important task coming out of the pandemic. So how are we going to do this? And what other sort of teachings have we learned from our neighboring countries? Thank you very much. Dr. Ricardo Alfonso Peña, your last words? Well, I believe that the most important thing is to learn from others' experience. When we see this life expectancy curves and fertility curves in countries such as Mexico and Colombia, we see that they're quite similar. Chile is in the middle of countries like ours and Japan. But we can learn from the different countries, such as Japan, and the different policies that they're implementing. Because it may seem too simplistic, but this is a wide reach opportunity. Because the elderly people that we will have in the following years have already been born, and they're the young people that we have right now. So that's why it's so important for us to have a state policy. So what we see that Japan is trying to do with sustainable cities and productive cities, where a person can still be productive if they so desire, when they still have an income and they still have social security, not only a pension, and they also have some care services. And this is one of the things that Flor actually mentioned, which is actually the caregivers. Many people will not live with their families, but for those that they will become an economic burden. So these are some of the things that we need to consider when making these policies for the next decades. Thank you, Ricardo. And I mean, given how we have really run out of time, I would now like to hear your last words, Luis Miguel, just to conclude this wonderful panel. Thank you. Yes, sure. First of all, I would like to remind everyone that I'm almost 65 years old. I mean, I have been working on this for the past 30 years. At one point, I had to reach that age. But beyond what has already been said, an important topic right now is not only healthy aging, but also discrimination, age discrimination, ageism, and the integrated care of people. Viviana and Flor have talked about this. And we have actually helped to develop the WHO in the past 5 years, and that is now being talked about, and that will help us provide better social services, which is fundamental. And in terms of knowledge creation, I'm talking about inequality, and I think that this is extremely important because we can actually have a direct impact, which is understanding the biological topics that are pretty much the embodiment of how it impacts on society. Why do poor people die younger, and which biological issues are behind, and which ones are social? So yes, it's important for us to have this privileged space so that we can understand the different probabilities and disabilities that are considered within our population. Okay, so thank you very much to everyone, and we will probably have other meetings further on because there are several things that are still needed to be talked about. This is the last part of our summit for longevity because it's not only healthy aging. Thank you.